Okay, so chances are you have probably experienced some sort of back pain. According to the Centers for Disease Control and Prevention, 1 in 4 of us adults say they suffer a day-long bout of pain in the last month, and 1 in 10 say the pain lasted a year or more. The older you are, the higher your chances of getting this common ache.
But that doesn't mean you have to live with it for the rest of your life. The doctors at Delmarva Chiropractic in Salisbury are providing relief using an old therapy with a modern twist.
At Delmarva Chiropractic in Salisbury, Bland Wallace is well on his way to getting rid of something many Americans are all too familiar with, back pain. And that relief comes in the form of non-surgical spinal decompression therapy.
Non-surgical decompression is a way to put traction along the structures of the person's spine to bring a negative disc pressure.
Dr. Kevin McCamey of Delmarva Chiropractic says creating decompression of the spine helps patients who suffer from pain caused by bulging discs, herniated discs, spinal stenosis, and sciatica, just to name a few.
Gravity exerts a certain amount of pressure on all of us, and so upright posture and the weight of our body, putting pressure along the structures of our spine, put pressure on the disc itself, which is the shock absorber between the bones.
Dr. McCamey says that's why many of us lose height as we get older.
People will talk about losing height. They'll say, well, I've lost 1.5 inches or 2 inches over the last several years. That's because those discs actually shrink in height, and you lose that height through the length of your spine.
And the pain is not always in the back. Dr. McCamey says that pressure can shoot pain in your arms and legs, too. Spinal decompression is nothing new. It's been done in many forms before.
Inversion is one of those types of ways. So you turn the person upside down, hang them from their heels or hang them from part of their body, and to reverse that gravitational force, those gravitational forces on the disc itself.
But this table uses a computer, which delivers more precise decompression.
We pull at a certain rate, and then we hold those structures in decompression for a certain amount of time. We relax them, and then we pull them again. And so this is all computer controlled over time at very specific and very controlled levels.
Avoiding the conditions that require spinal decompression can take a lifetime of care.
Spinal health is an important part of things. So if we take care of our spine from the time that we're young and don't expose ourselves to a lot of shock or trauma, we can help with that. Generally, we all have some form of degeneration of our spine over time.
Dr. McCamey says the time it takes for non-surgical spinal decompression therapy depends on the patient's condition.
The time or duration of the treatment is set by the computer, by the number of repetitions and the actual protocol that we're using, and those can take anywhere from 8 to 23 minutes.
He says a treatment plan usually involves 4 sessions in the first week, 3 times the second week, and 3 times the third.
Depending on how the patient responds and depending on the severity of the condition, some conditions are resolved in as few as 10 to 12 treatments, and some can take longer.
A relatively short amount of time to invest in possibly a lifetime of relief.
And I asked Dr. McCamey, at what point should you have back pain addressed by a doctor? I mean, we all get a little pull, a little strain here or there, and he said you treat it with ice and heat, maybe stretch it out a little bit. If it persists past 72 hours, then you should probably have it evaluated. And Jimmy, we've talked about it before. My father suffers from spinal stenosis. He has for years. I wish that he had access to this therapy 30 years ago.
Yeah.
I think his quality of life would be so much better now.
Well, they're figuring it out.
They're figuring it out, yeah.